let's get started. I do have a lot of questions for you, and I'm hoping that you'll be able to shed some light on veterinary science. I don't think it's one of the most talked about careers, so I'm hoping that we'll be able to give persons some insights. Come here, you bad mindy. Come here, so your front camera clean though. Oh, clean off the front camera there.
Wait, me?
The most.
Okay, I'm ready and raring to go. Shoot them.
All right, so share with us your journey to your career as a veterinarian.
Okay, so this is a pretty interesting story. So, you know, y'all give me your attention and your ears.
We like stories.
Yeah, so basically, ever since I was young, probably around 8 years old, I wanted to be a vet. I don't know how I learned about veterinary medicine or veterinarian, but I learned about it and I love taking care of animals. Funny story about my first save for an animal was a chicken. My mom used to rear chickens, and one of our dogs got into the coop and bit one of them on the crop. The crop is a storage organ, a food storage organ. And when you went to the coop in the morning, the chicken's crop was just draining water because it was drinking water. It was just basically coming back out. And I stitched that chicken up, and the chicken lived. Unfortunately, the dog came back to finish its work.
Round two.
When my chicken got and
the food storage organ is like our stomach.
Yeah, I really don't have a good end to this, but it was the effort. The chicken lived. If the dog didn't reattack the chicken, then it would have lived. But since then I wanted to become a vet, and I went to high school, went to sixth form, and honestly,
what high school did you go to?
Huh?
What high school did you go to? For our listeners, because I know this stuff.
I went to Westwood High School, then I went to Herbert Morris's sixth form. And honestly, at the time, I really didn't have any guidance as to what was necessary to be a vet. I was like, okay, I want to be a vet. I was just doing sciences, doing art, just doing everything. I dabbled in everything. And after I left sixth form, I did not go into school same time. I actually worked for a call center, and that was a time I actually researched into what was necessary to be a veterinarian. And then that was the time I learned about volunteering, actually helping, and the grades. It's actually pretty competitive to get into veterinary medicine school. So I basically was learning about what I needed to get in after I had already gone through the schools and everything. So I did some extra lessons at Western Educational Center, I think that's the name of the institution. Did over my CAPE subjects, volunteered at a veterinary clinic. And with all of that, the volunteering, the hard work, it was a lot of late nights and all kind of stuff. But when I applied first, I didn't get in because my grades weren't that great. But after I did the subjects over at Western Educational Center and I volunteered, then that's when I got in to veterinary medicine.
So, what subjects would you say is needed though? Because you mentioned that you did some subjects, but you weren't sure before you did your research.
So basically, they required CXC level biology, CAPE level biology, chemistry. They may or may not require physics. Mine didn't require physics. I did CXC physics. I didn't need to do CAPE physics. And math.
Okay.
Yeah.
Surprisingly math. All right. So if a student was pursuing a career in veterinary science, you'd recommend that they do the sciences straight from high school, or the school is requiring them, not you recommending. The school is requiring them to do CXC biology or science from high school.
It's required, so you need to do it. You need to do the sciences. And math.
And math, just in case we never hear that part. All right, and you mentioned that you did some volunteering as well. Do you think that volunteering at a veterinary clinic influenced your decision or continued to motivate you continue to motivate you to be a veterinarian?
I think it continued to motivate me rather than influence me because I wanted to get in. You know, one of the things that is a push for anybody is when you try to achieve something and you don't make it, and you start to wonder, what if I had? And you start to well, at that time for me when I didn't get in when I first applied, because I thought that, okay, I was sure to get in, there was no way they could reject me. And they did. And seeing that rejection was a huge slap in the face, like, you're not good enough yet, you need to go get it together before you can come into this school. And it actually opened up my mind when I was volunteering, like, this is it made me crave it more, maybe want to do more. So it motivated me a lot more.
Okay, I love that. All right, so do you think, or when you were doing the applications to start your veterinary science degree, did it require the volunteer, or did that set you apart then from regular applicants?
Actually, contrary to popular belief, that if students research know what it is required to get into veterinary school, you'll see that volunteering is actually looking like gold on your resume or gold on your application form, because these schools want to see that you are really interested. They want to see that you're putting the effort. So grades are great, but they want to see that you have the practical skills and all to get in. So it will help a lot. Volunteer.
Because I always say that too, like, schoolwork is one thing, but when your resume looks the same as everybody else, then it's not, well, your application too looks the same as everybody else. It doesn't give you that edge that you would need to say, hey, pick me, I'm ready. So I'm happy that you brought that up. All right, so I have, so my next question is, what, after you've completed your degree as a veterinary science, what were some of the surprises, considering that you did your research when you were ready to apply? What were some of the surprises that you met when you got into your career?
One of the biggest ones, which it wasn't really a surprise after I finished, once you're doing your clinical rotations in school, you kind of get an idea of this, is that you deal mostly with the clients more than the patients. So for small animal vets or large animal vets, mostly small animal veterinarians, and I'll speak on the different arms of veterinary medicine later. But you'll note that you are in contact with the clients a lot. Many persons, when you research or you interview persons who become vets, they're like, I thought I was only going to deal with the animals. I didn't sign up for this. If I wanted to deal with the people, I would have just gone into human medicine. But you deal with the people a lot. There's a lot of emotional involvement. And also veterinary medicine or veterinarians were considered to be the number 4 profession on the suicidal list in the entire world of careers, because of the whole emotional stress that it has on the people, or has on clinicians, especially in small animal practice, because sometimes you're put into situations where you have to make a decision that's not necessarily something that you really want to do, but you're something that you're forced to do because of the practicality of the situation. Many persons talk about euthanizing animals because of the, their term.
You're using a big word there. You have to break that big word down for us.
Euthanasia is basically a terminology that is used for putting an animal down, making it humanely, putting it to sleep, so it will no longer be alive. And sometimes animals are critically ill where the quality of life is questionable. Now, I know that euthanasia is legal in some places for humans, but it's a terminology that has actually stemmed from the veterinary profession, and many veterinarians have been forced to make decisions based on the quality of life that the animal is going to have, or so, and it puts a lot of strain on people. And sometimes, in different situations, it takes a lot emotionally. So many persons don't know that. They only think that, oh, I'm gonna be with the dogs and the cats and the rabbits and all, and they don't see that other side to the practice.
Well, I've never thought about it either. I'm not gonna say I love animals as much as you do, but I don't like seeing them get hurt. So I definitely understand why that would impact someone emotionally. All right, so you were just talking about vets for large animals and small animals. Can you break down the different arms of veterinary science, like the different parts that they can study?
Okay, so for how should I put this? So you actually have a lot of arms of veterinarians. Like I didn't even know this. I was like, okay, probably they just took care of cats and dogs and that's it. So you actually have um, large animal practice, which refers to vets who take care of cattle, goat, sheep, pigs, right? So and it is also referred to as farm animal practice. Now, equine medicine, equine refers to horses. So if you ever hear anything about equine, equids, those are horses. Though that's actually an arm underneath large animal practice, but equine vets are kind of in a classification by themselves because usually equine vets only deal with horses because horses are pretty fragile creatures. They're big and they're wonderful, but they're very fragile. Then you have some large animal persons that deal with chicken. So like in the broiler or layer industry, broilers are the chickens that you basically get when you go to the shop and buy some chicken meat. Those are the chickens that are raised for meat. Layers are the ones that you get for eggs. So you have vets that work with those, and they're still classified as large animal practice. Then you have small animal practice, which deals with the cats, dogs, rabbits, and then you have, or some small animal veterinarians will do exotic animals, birds, rabbits, hamsters. Then you also have the other part of veterinary medicine, which some persons would classify as maybe the boring part, but it's actually pretty interesting. There's epidemiology, and that has to do with statistics and learning how different things impact a population and all of that. So, epidemiologists are involved with diseases like, let's say, for instance, COVID-19, because that's the hot topic, of the thing. So, epidemiologists would research on the spread of the virus through a population and what portion of the population was affected at a different time and whatnot. Then you have virologists who are veterinarians. You have public health veterinarians who deal with ensuring that the meat that you purchase is safe to eat. And you find these veterinarians in most like working with abattoirs or processing plants. So you may look on your sausage or something, you see veterinary approved or something. Those are the vets that approve that the animal that was slaughtered was safe to eat. So it has many different parts. You have veterinarians that work in labs, that work with lab animals, so many persons, I think this is actually declining because of in cosmetics where you look on your cosmetics, you see not tested on animals, but there are vets that work with animals that test not only cosmetics, but they're drugs that you use for yourself that need to be tested, and they have to use animal subjects. So there's a whole bunch of places that veterinarians work. So if it is that someone is thinking of becoming a vet, and one part, when they research it properly, one part doesn't interest them, trust me, you have so many other places that you can go. There is pathology, because there's when animals start to die, you want to figure out why they're dying. That's pathology. So many different places. Like it's amazing.
Wow, it's the same day. I was just like, interesting. I didn't know all this. Like, honestly, I just thought, that when you walk downtown and you see the veterinary clinics and you're like, okay, they take care of animals, that's it. Like, that was it for me.
Yeah. And then persons like, okay, so we as vets sometimes have to be fighting for people to understand our profession holistically, meaning that some persons don't understand the human animal bond. I think it's recently with COVID-19 that persons are like, okay, can my dog catch it? Can my cat catch it? okay, the doctor said that a tiger in the zoo caught it, can I catch it from that? And that's where the zoonosis refers to anything that can be transmitted from animals to humans or humans to animals. And when persons come into our clinic, or you're talking to a client, it's your duty as a vet to educate your client that okay, you can probably catch this from your dog, or your dog can catch this from you, or you can catch this from the cow or the sheep or something that you're working with. So because many other diseases that are circulating, they're originated in animals. So persons don't really think of it like that. Okay, what part does your vet play in this particular subject matter? And it's really, really huge. It's really huge.
Right. Well, thank you so much for educating us, because I was one of those persons walking around like, okay, vets only take care of cats and dogs and birds, and that's it. Like, that's it. So thank you so much for educating us. For persons who are looking to venture into the career of veterinary science, whatever arm you're looking to join, please do your research. If it is that you need a mentor that will help you to navigate this stormy seas, because hey, it's a lot, go to theminds.com, ask to connect with Tracey-Ann Buchanan, and you'll have a mind that can help you. Guys, don't do it alone. All right, so more questions. So now that you've educated us, like, what is the day in the life like for a veterinarian?
So, okay, it depends on which arm of veterinary medicine you are working in. My day specifically is going into the office or into the veterinary clinic, dealing with my in-house patients, and in-house patients refer to animals that I have hospitalized. So I would have sick animals there, and, I ensure that they're okay, ensure that their medication is up to date. If we have surgeries, whether elective or surgery that needs to be done on a sick animal, it is done, and then we see patients throughout the day. We do vaccinations, that's routine general health care, endo and ectoparasite control. And endoparasites refer to parasites like living inside of your example, the worm, the worm that no one likes to talk about. Ectoparasite, fleas and ticks. And you may be surprised that about the many things that you can get from ticks. I will let you look up something that's called Lyme disease. That's one that we would refer to as a zoonotic disease that you can actually get from a tick bite. So that's my charge for you guys, to go research Lyme disease and the bacteria that causes the infectious agent, the infectious process or the disease. And then from seeing patients, you may have emergencies. You basically never know how your day is going to go, really, because you have your schedule, you have your plan, you try to plan out as much as possible, but sometimes it doesn't go as how you want it to go, because you may have emergency call-outs, things that can happen, and a myriad of things happen throughout the day. Then, at the end of the day, we go home and then we do the same. We repeat. And as I said, you have your schedule on how you want your day to go, but it doesn't always go that way. For a large animal vet or a mobile veterinarian, they're on the road they're on the road all the time, and then they're being called out to see different patients. They are actually going on site. So instead of the patient coming to them, they're going to the patient. Because some persons really can't bring their animal down into the office. They don't have the methods to do so. So they have to go to them. And then for large animal veterinarians, depending on where you work, because if you work within a particular facility, like in a let's say in a farm, on a farm, or on several farms, typically you may go to several farms. So it's a whole bunch of driving around. You're dealing with animals that probably milking animals. You guys know that veterinarians, the animals that produce milk. Now, many persons, let me tell you something. When I was little, I didn't know that a cow had to have a baby to produce milk. I did not know that. They're like, okay, from I see a cow, the cow gonna have milk. No, the cow needs to have a baby. And the cow, once a cow has a baby, then that's how you get the milk. And then they milk the cow for up to 10 months.
Wow.
10 months. And then what the veterinarian does is they breed these animals, because with the places that produce milk, the animals have to be ensure that they're kept pregnant. So you can keep on getting pregnant, you produce milk and all that. So that's just an example. With I went through previously the different many different roles that veterinarians play, many different arms of veterinary medicine. So their days would be so different. You would be amazed at how many things that are done. It's a lot. It's quite a lot.
All right. So what I'm getting from you is, so your veterinarians are doctors, but you're just doctors in the animal population. Like, I get it now. That makes it so much clearer. And Kamir, I didn't know that either, Dania. So whatever, Kamir. Dania was just asking, so animals get vaccines too, like sis?
Yes,
We
they
didn't
do.
know that.
Yes, they do. Yes, they do, because there are many infectious agents that can affect the animal. So I'm going to use, for example, a dog. A dog gets vaccinated against several things. You guys know about rabies. We don't have rabies in Jamaica, but they have to be vaccinated against rabies. And rabies, basically, once you get it and it goes to your head, you're a dead person. So for places that have rabies endemic, they're like in the States and in England or wherever, they have to have it. It's a requirement. It's a must. It's what's the word I'm looking for? It's compulsory. The animals must be vaccinated against rabies, because you have these animals interacting with humans, and let's say that you have a rabid dog, then you're putting that person at risk of getting that infectious agent. There is something called distemper. There's many viruses that affect these animals. We have to vaccinate them against it so that we decrease it. Chickens get vaccines. The chickens that you eat, they have to be vaccinated because there are many diseases and viruses that affect them. And what happens is, unlike what we're having now, there was a saying when COVID-19 just came out that if a veterinarian was in control of the whole thing, it would have never reached so far, because it's basically our job. We're technically always fighting infectious agents because of how our job is set up. Because there's something referred to as herd health, where you not only look at the individual patient that you have, but the herd, the entire population of the animals. And if an animal is sick, your job is to prevent everybody else from getting sick, right? So we have to vaccinate animals. So yes, Danielle, animals do get vaccines.
Wow. You are educating us, because I did not know that. All right. So, several things that you brought up that we're going to talk a little bit about. So, first, before we get into that, how do you balance the work role with your family life? Like, is it that case where you're on calls and you have to probably run up the house at 2 o'clock in the morning? What's that like? What's the days off like?
Okay, so to be honest, I'm still trying to find balance. You know that I'm a new mom. I have a 6-month-old son. So it's kind of, trying to put myself to spread myself wide and to basically, do my job well, excel, try to be better at my profession, because there's always room for improvement, and be there for my family as well. And I'm still learning to do that. So I have not mastered the balance yet. When I do it, I'll let you know. But it's a pretty difficult thing to do. And, I'm still working at it. It requires a lot of patience, a lot of planning. I'm a spontaneous person. I don't like my days to be planned out. I just like to just go with the flow. But with my son now, I have to actually have a plan, because if I don't, then my day spirals out of control and I don't know what happened with what. I have to have things in place, like just in case this happens, just in case that happens. And of course, I have a helper, which helps a lot. So yeah, I'm getting there.
Okay. All right. So for persons, again, looking to venture into this career, it's not a 9 to 5. Don't have that expectation of clocking out and thinking, hey, all right, we're just gonna finish working here. Because you always say that after work, you still have to do research. You still need to prep for your surgeries if you have surgeries tomorrow.
Mm-hmm.
So kudos to you Chris Anna cases, kudos to you, Dr. Tracey-Ann.
Thanks,
Working to-do list helps greatly. Yeah, absolutely. I got another question. Let me just bring it on the screen before it goes away. So it says, how do you feel about the little value Jamaican places on animal care? Example, how we treat stray animals. Good questions, Dania.
All right. So it actually is, I think, one of the things that we have in Jamaica, which I think is changing a bit now, because based on what I'm seeing, it's a cultural thing, because people grow up, and this is not really their fault. People grow up and they get told that the dog get chew up bone. So you know, after you eat, and you suck out the life out of the bones, and you know, you scrape it, give the dog, and the dog digest it. And you know, when I was young, I used to wonder, does the dog have like a grinder in his throat? People, do not give a dog any bones.
Educate us, please.
Your esophagus, your gastrointestinal tract is the same makeup, same soft tissue, same everything. And the bones can actually perforate and
using too much big words, make it fun for us.
It can pierce through the dog's intestines and cause issues, cause bleeding and all. And we refer to anything that should not be in the dog's intestines as foreign body, and if you have foreign body impactions and such. So don't do that. Now, persons, I think, are getting more sensitive to animals. You know, persons should just say, oh, only purebred go vet, man. Only purebred go vet. But we're seeing a lot of mixed breed dogs coming into the office. You know, persons are actually not putting their love only on the breed of the dog. You know, many people like the fluffy dog, the Shih Tzu and the poodle and the teacup dogs and everything. But many persons are actually also falling in love with the mixed breed dogs, the what I call the mongrel, right? Mind you, the mongrel is also a Rottie and a Shepherd mix, because it's not purebred, you know. So these persons are actually becoming more sensitized. We still have a long way to go, you know. But I do see changes, and I believe that there are a lot more changes going to happen, you know, with persons becoming, once they learn, people, you see, when people are educated about something and they start to understand it, they understand why they're doing something and why not to do something. I think with that knowledge, then it brings a revolution. You know, they start to learn more, they start to change your mindset on how something is supposed to go. And I believe that, you know, persons are learning, and I'm open to seeing more improvement in future.
Same. And I guarantee you, once we're educating the persons on how to treat animals, I'm pretty sure that the numbers would how often we see stray animals, I'm sure that will decrease. All right, so we have another question. You made mention of putting sick animals to sleep. How do you help someone cope with that loss?
So you're basically putting yourself in their shoes. It's never an easy decision to make, you know, when your animal is terminally ill. Meaning terminally ill means that there is nothing else that's going to change around the quality of life of that animal. Kidney failure, heart disease, that's going to cause animal to become worse and suffer. The beauty of euthanasia is to basically prevent animal from going through that suffering, you know. I personally have a grandma that has been bedridden for 12 years. She can't do anything. She's a vegetable. And you know, she's not getting any better. She has gotten worse somewhat, but it took a lot of time. And if you can imagine yourself just being there, not being able to do anything, and you're feeling sick all the time, and you know, it's a pretty difficult thing, and it's difficult but it's a difficult decision for owners to make, because you know, when it comes to life, it may be a controversial thing for persons to think of, because some persons don't believe in it, some persons do. It's a different thing. But when persons do make that decision, comfort, sometimes, you know, nothing that you say can actually reverse the pain that they feel, but it helps them to feel better with sympathizing, empathizing, providing that shoulder to lean on, let them know that you're there. Persons appreciate it a lot. So, comforting is an entire skill. It's an entire skill to learn how to comfort someone in that time of need. And eventually you do learn how to do it. It's not something that anyone can teach you. It's not anything, because even if somebody teaches you what to say, every situation is different. You just have to be able to feel for those persons. And that's why I tell you that this profession, when it comes to small malpractice, it takes a lot of emotion, because you're there crying in your heart, but you can't cry for them. You have to be the strong one for them and being that support. And it's a very important role. And I'm happy to be that person that many persons can rest their shoulder on, and rest all of that guilt, all of that pain and hurt on when they're losing their pet or when they have lost their pet.
And I think too that's like with any loss, so whether it's an animal, whether it's a pet, whether it's a family member, it's the same loss.
It's the same loss.
So you can treat it the same. So however you would help them if they lost somebody they love, it is someone they love. It's just in the form of a pet. So the same thing. Okay, yeah, you're back. All right, so my last question, or maybe my second to last question. All right, so you went to Trinidad to study for your to become a veterinarian, right? Saying a veterinarian. Is there anywhere else I can study to be close to home, especially for persons who are from Jamaica?
Okay, so there are other options. I mean, it's not that many. There is St. George's University in Grenada. That's the only other Caribbean-based one. There's Ross University in St. Kitts, but that's an American-based school that's in the Caribbean. The University of Trinidad and Tobago, the St. University of West Indies Trinidad and Tobago branch, that's actually, many persons choose to go there because it was actually the most financially feasible.
Loading again.
I don't know what's happening, but can you still hear me?
Yes, I can hear you.
I'll just proceed. You just stare at my beautiful face frozen on your screen. Yes, so persons choose to go there because it's part of the branch of University of the West Indies, and it's one of the cheaper schools. Now, mind you, veterinary medicine is not cheap. The range, and I was researching the cost of it, because in school we used to hear that our school fee is not too bad. When you look at other places, they can range from 200 to 400 and something thousand US dollars overall for the program. And that's a lot of money. That's almost $500,000 US dollars, right? So you find that the persons that study in these schools have huge student loans to pay back because of the cost of actually paying for tuition is not cheap. The government of Jamaica used to subsidize our tuition. They used to pay for 85% of our tuition at the time. They no longer do. That has been a topic of controversy and discussion why they're not paying for it and all. However, they used to pay for it, and it actually was a huge help, because imagine if it is that you only had to pay 15% of your tuition plus your living expenses. It takes off a huge burden off of you. It's still quite a bit that you have to pay, but it's a lot less compared to what you have to pay. But as it relates to your question, St. George's is probably the only other one that's Caribbean based. That's in Grenada.
Okay. And how do you diagnose your patients, considering they can't talk to you to say, hey, my leg hurts or my stomach hurts?
So a lot of small animal practice is based on your physical your physical examination and observing animal behavior. Because as you said, our patients can't talk. So there are certain behaviors that they will exhibit when a particular thing is hurting, a particular thing is wrong. and you have to be in tune. You have to use your senses as it relates to observation and smelling things and touching. You utilize all your senses to figure out. And then there's also additional diagnostics. I mean, yeah, we do have laboratory diagnostics that we use, similar to what human doctors use: CBCs, biochemistry profiles, urinalyses. In the fancy first world countries, they have CT and MRI scans. We have X-rays, ultrasounds. So we have those other things to aid with our diagnostics.
Oh, okay. So it's pretty similar then, again, comparing it
Similar,
to...
however, you have to do your physical examination to zone in on what's wrong, because cost is of a huge concern to clients. You know, you're not going to just spend off your money like that, you know, because if it is that doing something will help to prevent you from having a client bear a particular cost, that's important. Cost is a huge issue that has to be a huge topic that has to be considered with practice, because many persons, you know, the one man will have him look a dog and can't pay for all the huge things. What do you do then? You know, you don't have all the options. It may be available for somebody else who can afford it, but what about the man who can't afford it, right? So you have to use your skills to get
The essence, just like you do with a baby. I totally agree. All right, so this is the last question from me now. All right, so with veterinarians, you do, how does it compare to the schooling of a doctor? Like, do you still have internships? Do you have to do 5 years, 7 years? How does it compare?
So actually the programs, it's similar but not the same. I said that because it depends on where you study. Like in the States, a veterinary degree can range from 7 to 9 years. And
Wow.
that, or 7 to 11. I think it's 7 to 9 or 7 to 11. But they have to do an undergraduate degree first. I think it's a Bachelor of Science. And then they branch into veterinary medicine, which I think is a 4-year course. At the University of the St. George's University, they have a pre-veterinary program, because if you think about it, you are learning about a whole bunch of different species, right? Everything. If you want to be completely thorough with everything, right? A human is a human, one species, one individual, right? Everybody have them stomach the same place. Everybody have, well, everybody's supposed to have them stomach the same place. Everybody has their heart. You get the gist of everything.
Right.
But when you compare a cow to a rabbit to a rat, you know, to all these different things, it takes a while to learn everything completely. So that's why it takes so long. As it relates to internship, I think the doctors have to do 1-year internship after they graduate. We don't have that where you have to do that. I mean, so I think some places offer it, but it's not compulsory to do that. And as you can see, you know, once you finish your DVM, the DVM is the Doctor of Veterinary Medicine degree. That's what you get when you come out of vet school. Once you finish your DVM degree, then if it is that you want to specialize in something, or you want to go on to graduate, that's what they call it, graduate courses. If you want to do something in surgery or research or whatever else you want to do, then you take that degree and then you build on it. And then they have residencies, like what doctors would do when you're trying to specialize in something. You do have residencies in veterinary medicine as well.
Okay. All right, Tracy, that's all the questions I have for you. Thank you so much for educating us. I'm sure most persons now learn that they shouldn't chew the bones and then give it to the dog. So that was a helpful
Please
tip.
don't, people, please don't. I'm begging you not to. Don't.
And you told me a funny story about somebody who brought lunch for their pet and they brought a bone. So I think that was hilarious.
So yeah, don't give them the bones. The bones are pretty harmful. It will cause a lot of damage, right? So as long as you can't eat it, they can't eat it. Another note, right? Because many persons, you know, some persons know, some persons don't know. Onions, garlic, chocolate. I think most persons know chocolate. Grapes, raisins, prunes, do not give them to your dog. Don't. They are toxic.
I knew about the chocolate, but I didn't know about everything else. So thank you for educating us. I think there's one more question. She's asking, what are some postgrad or continuing education courses that you would recommend?
That's a pretty what I would recommend. I would say that, find out what you love, because all these things take a lot of time. You're investing your time, your money, your energy. So if you're going to do all of this, find what you love. So if you're interested in pathology, veterinary pathology is actually pretty interesting. It's like a forensic scientist, right? Where you basically find out why the animal died, how it died, and all. You could do that. If you want to go into virology, those interested to figure out if COVID-19 is real or not. Those conspiracy, if it's a conspiracy theory, you can go into that as well. There's epidemiology for those who like to do case studies and all the numbers and all. You can go into that. There are so many things. Like when we were going to school and you learned about the different things that your lecturers did. There is medicine. You can go into medicine, straight animal medicine, surgery, where you do all the fancy surgeries, orthopedic surgeries. A lot of people find bone surgery to be pretty interesting. Open heart surgery, into the chest cavity, all these different things, abdominal surgeries, you could go into that. So definitely find what you're interested in and then you stick to that, because there's basically a postgraduate or continued degree for everything.
Good answer to that. I hope that was helpful, dear Yana Ma'iri. So if you want to, if you have more questions for Tracy and you want to have a mind who is a veterinarian, you can just go to themindsup.com and you'll be able to connect with Tracey-Ann. We'll also be posting this live on our YouTube channel, which is the Minds of Jamaica YouTube channel. So you can share it with a friend, share it with someone who you know this information would be educational for. Also, please support our GoFundMe. We would love to give access to students who don't have any, and we can do so in the forms of providing tablets and data for those persons to stay connected to their lessons. Thank you so much for your time, Tracy, and thank you for everyone that participated in our live and joined our live today. Another Mentorship Monday successful check.
All right. We're being here, guys.
It was a pleasure to have you. Even though at this point we can't see you.
I'm sorry, but you have a beautiful face.
See you next week again, guys. We'll be joined by Mario Martin, who is an engineer, and he'll have some gems to drop on us.
Oh, I'm interested.
Thank you for joining.
All right. Bye-bye.
Bye.